We work hard as physicians to take care of the health and well-being of our patients. But when it comes to our money, do we have the same condition of care? Probably not. Let's change that together. Welcome to the Financial Freedom for Physicians podcast, where we'll fight and advocate for your financial literacy. As always, I'm your host, Dr. Christopher Liu. Thanks for being here. Let's jump into the show. Hey guys, I want to welcome you guys to the Financial Freedom for Physicians podcast. We've got a great episode this week. Before we begin, please hit the subscribe button as well as the notifications bell, and be sure to like, comment, and share if you like this episode, and we'll get into this week's sponsor and show. Today's episode is sponsored by Dr. Heather Fork of Doctors Crossing. Dr. Heather Fork is a retired dermatologist based out of Austin, Texas, and she is a career coach and strategist and the founder of the Doctors Crossing. She's come out with this new course called LinkedIn Networking for Physicians. The significance of this course is that in today's hyper-competitive, hyper-dynamic, ever-changing economy, success is all about information, speed, access, networks, and execution speed. So part of your success in today's economy relies on a strong network of collaborators, partners, and acquaintances who can help you accomplish your goals a lot faster and more efficiently. If you're operating under the mantra of doing it alone or doing it all by yourself, there are better, faster, easier, and more efficient ways to get things done today. You can save a lot of time, energy, and money by learning how to leverage social media to network online. Dr. Heather Fork's course is a brand new course designed to teach you step-by-step how to efficiently network using online, LinkedIn, social media networking tools, tactics, and strategies. She's been a pioneer in the field of physician counseling, physician burnout, career transitions, and physician coaching. Her course is a 6-module course with 22 videos where you can learn at your own pace, on demand, and teach you how to strategically use LinkedIn to your advantage. It also has a bonus PDF guide, how to rock your informational interviews. So if you're interested, you can check out the course in the link in the show notes below. As a special bonus, you can also check out Dr. Fork's Carpe Diem resume kit that when purchased with the LinkedIn course, you get a 23% discount. Or if you want to purchase separately, you can click on the link in the show notes below as well. Thanks for listening, and on to the show. So welcome everybody to this week's podcast episode for the Financial Freedom for Physicians podcast. And I'm your host, Dr. Christopher Liu. As you know, my mission is to empower you guys to achieve financial freedom, independence, live healthier and balanced lives so that you can practice medicine and do your calling on your own terms. And so as part of that mission, I try and go out there and find guests and people that are doing really interesting, innovative, new techniques, ideas, strategies. And so today we have Robyn, who is she is the founder and CEO of Stress MD, as well as the host of the Stress Free MD podcast. So she is a life coach. She is certified in yoga and meditation, and today she's going to talk all about the breath awareness, using your physiology to live a stress-free life. So, Robyn, welcome.
Thank you. Thank you, Christopher, for having me. I'm really a big fan of your podcast and of all your work. So it's an honor to be here.
Yes. And we connected through Andrew, and we were talking backstage, and what I found interesting was I love your energy and the vibe and just the positivity and the calm, and I was hoping that the audience can pick up on that. So we'll talk about your journey, how you get started, and go from there. It'll be a really interesting conversation.
Yeah, absolutely. Absolutely. So my journey started, wanting to be a doctor when I was really young and 8 years old, and seeing a skeleton for the first time and thinking it was really amazing, and wanted to study medicine beginning at age 8. And, fast forward, I went through medical school and, internship in internal medicine and residency in radiology and fellowship and body imaging, and started practice in diagnostic radiology. And although, medicine is truly amazing, I know that I truly believe that it's an incredible privilege to take care of patients, and I still do. I started to develop lots of symptoms, lots of illnesses that I couldn't put together, that doctors could not put together. And it just seemed very disconnected. I became, as we know in medicine, as an interesting case or a complex case, which, Christopher, as you know, we don't want to be a complex case, right? Ever. So, from migraines to vertigo to reflux to tinnitus and bizarre paresthesias in my hands and feet and lots of pain in my body and not sleeping and not digesting my food and actually starting to just tumble downward and having some dark thoughts. So that's what happened over time. It was several years ago. It was before people actually were talking about what we know now to be essentially burnout. But after taking lots of pills and seeing mental health care professionals and not getting better, I just looked outside Western medicine to put my left brain into it, figure out through the medical literature what I could do to take care of myself. And that's what I did. And I found that there were lots of articles in our own medical literature talking about the benefits of different things like yoga, like meditation, like coaching, and so on. And those are the things that I started participating in. And believe it or not, all of my symptoms went away. All of them.
Wow. That's amazing. It's really amazing when it's like stress and just the hustle bustle and the daily grind. You don't realize the toll it takes, but then it's like it's when you go back to spirituality and just mindfulness and physiology, it's amazing how the body can heal itself.
Yeah, so the body responds to what you said, stress. So I had a whopping case of chronic stress. Right, that's what my diagnosis was. It was that was it. But none of us picked up on it. I didn't pick up on it. None of my colleagues, no gastroenterologist, neurologist, periodontist, mental health care professional. I mean, whoever I saw, they just saw the symptom of whatever they were treating, gave me a pill for it or something to do about it, and off I went. So yeah, so stress is pretty powerful, and it shows up in some pretty interesting and sometimes kind of bizarre ways, but that's what it does in your body. But that also means that you can actually reverse it and teach yourself how to feel better all by yourself. You just need to learn what we never learned back in med school, how to do that.
Yeah. It's interesting because I've been reading a lot of books on physiology and breath and conscious awareness, and so I know you emphasize breathing and physiology, and you help clients live better lives through that. So tell us how your practice and your philosophy around using your physiology.
Yeah, physiology, because, I love science, right? And we're doctors, we love science, and we always like to know the why. And a lot of my clients, mostly physicians, also need to know the why. So the why is the physiology. What happens when we start to work with that? What happens when we actually pay attention to what we learned back in med school, and then we utilize it to help ourselves? And so you mentioned the breath. That's one thing. Breathing. Well, we learned a lot about the respiratory system, but we didn't actually learn that there are two really important components of our breath. And it really goes back to first understanding the umbrella of the autonomic nervous system. So the autonomic nervous system, which I like to think of as the automatic nervous system, right? Because things are just happening. You're just breathing, your heart's just beating, you're not telling your body to do these things, right? So we have our autonomic or automatic, and that has two main components, right? So we have our sympathetic or fight or flight response and our parasympathetic or rest and digest response. And we
Uh-huh.
want those two pieces of our nervous system to be friends and to be working together and to be in what we call homeostasis or balance. But with chronic stress, they're out of balance. They're out of
Uh-huh.
balance completely. We have way too much sympathetic nervous system going on. And so, what we want to do, for example, with our breath, is to go back to these 2 points of our physiology. The first point, Christopher, is that our exhale breath decreases our heart rate and our blood pressure.
Mm-hmm.
And our inhale breath increases our heart rate and our blood pressure. So when we go back to basic physiology of breath, we focus on the exhale breath and allowing that to be nice and long. That actually naturally brings our heart rate down, our blood pressure down, and we can feel calmer. So that's the first piece of physiology with our breath. The
Mm-hmm.
second piece is where your breath is in your body, where your breath is in your body. So the vagus nerve, which is the longest cranial nerve that we have, it starts in our brain and it goes all the way through our body into our abdomen.
Mm-hmm.
That nerve, Latin for wanderer, is the nerve that's responsible for our parasympathetic response, our calm feeling, our rest and digest, our relaxation.
Mm-hmm.
And so when we breathe into our abdomen, into our belly, we activate that nerve and we activate our parasympathetic nervous system and can feel calmer. So stressful breathing is sympathetic nervous system. That's up in our chest.
Uh-huh.
Calming breathing is parasympathetic nervous system, and that's in our abdomen. So the two key points of physiology for breathing are focusing on your exhale, that
Mm-hmm.
long, calm exhale, which will decrease your heart rate and blood pressure, and the location of your breath, breathing into your abdomen to increase vagal tone, to allow that rest and digest response to come on board and allow you to feel calmer.
Oh, that's interesting. I didn't know about the where the breath is in your body. So that's very interesting. And how do you, and then so you combine it with meditation as well as yoga. So and then how does that incorporate into your practice?
Yeah, so I like to think of there being three main components to, as you say, living life on your own terms. You can live life on your own terms with your financial freedom. You can live life on your own terms with how you feel in your body and your mind, right?
Mm-hmm.
And so the three main components, we talked about the breath, that's one. Meditation is another one. So taking care of your breath is one, taking care of your mind is another. There's two components to that, meditation being one. And a lot of people think meditation is, oh, I have to sit uncomfortably for long periods of time, dealing with all my crazy thoughts in my brain, 60,000 of them a day, most of them not so nice. I can't do that. And so, you know what? I can't do that either. And so there are lots of flavors of meditation. And I know as doctors, we're busy, people in life are just generally busy. It could be seconds, it could be minutes, it could be hours. It's whatever amount of time you have. But there are many flavors of meditation. And, mindfulness is probably the underlying piece to all flavors, just about. And what that means is paying attention on purpose.
Mm-hmm.
And you can think of mindful as one word or mindful as two words, right?
Uh-huh.
So mindful as two words is just imagine a thought bubble above your head when you're having those 60,000 thoughts, right? There's no room for anything else. Whereas when you're being mindful, one word, you're actually aware of what's in front of you. You're aware of what's surrounding you. You're aware of how you're feeling. And the quickest way to do that is actually just to bring your attention to your senses,
Uh-huh.
right? So our five senses are always available to us. If I said to you, Christopher, how does it feel right now with your body sitting in that chair? Because you're probably sitting right now, but you may not have noticed that parts of your body are touching the chair. Bring your attention to that. Bring your
Mm-hmm.
attention to the sensation of the air on your skin that's not covered. Does it feel cool? Does it feel warm? Do you have any taste in your mouth? Do you smell anything? Do you hear anything besides my voice? If your eyes are open or closed, what do you see? So, one of the quickest things we can do with meditation, since most people say, I don't have time and I can't do that, is actually just bringing your attention to your senses. You come
Mm-hmm.
out of busy thinking mind, which is where we spend most of our lives, and back into your body. So, that's just a real quick way that you can weave meditation into your life. And then there's more structured meditation. So I'm certified in what's called I rest, little I, big R, like the iPhone, I rest. And it's right, because who doesn't want to rest, right?
Yeah.
Christopher, like, who doesn't want to rest? So it was originally created for Walter Reed Army Hospital several decades ago because our military was in need, and they still are, of relief from their suffering from PTSD. And if it was called meditation or yoga or anything like that, they wouldn't do it because they would have all these preconceived notions. So the Dr. Miller, who came up with this type of meditation, weaved in traditional meditation and some psychotherapy, took out things that were potentially triggering, and created a very safe 10-step process to meditation, which is guided, which means you don't have to think about it. You just listen. And it's been found to be so effective for processing experiences and relieving suffering from trauma in everyday life that it's also been found to be incredibly beneficial for relieving chronic pain in the body. And the Department of Defense declared this meditation a tier 1 treatment for chronic pain in 2010, which means it's equivalent to taking pain pills. It's like equivalent to actually taking an opioid, because so much of the pain in our body that we feel is from tension, from all that tension, because our stress response tensions our muscles up, and then we get stuck with these tense muscles. So meditation comes in many flavors. I just gave you 2. And then how else do we work with our mind? Well, life coaching, right? So working with your mind, getting a personal trainer for your brain, right?
Yeah.
So what do we do with those 60,000 thoughts? How do we work with them? You mentioned earlier when you're introducing me that you can really focus on determining how you feel and your emotions. And in life coaching, we learn that our thoughts actually determine how we feel, determine our emotions. That determines how we show up, and that determines the results that we create in our lives. So we start to work with our minds and our thoughts. We can actually create the feelings and the emotions that we want to have, therefore show up how we want to, and we can get the results that we want in our life. So taking care of your mind comes in those 2 components, that meditation piece as well as the life coaching piece. The third piece is taking care of your body. And I'm trained in somatics, which is a very specific way, although very simple way of movement that releases chronic tension in your body. So you can actually increase the resting length of those chronically tense muscles and feel better. So those are the 3 main components that I work with and that I educate others on.
Yeah. Well, that's fascinating. It's just the way you describe, your physiology, and then you describe how the thoughts, and then how you process, and how you process chronic tension, and where trauma and chronic stress gets stored in certain parts of the body and it's relieved by movement. It's very fascinating. Wow. So then now you've taken that, and you went from traditional medicine, you got a lot of training, and now you're helping clients. So describe some of the, I know you've done a lot of retreats and coaching. So describe some of your successes, and how a lot of stressed out professionals can start becoming more aware of this field.
Yeah, so I transitioned into this area of stress management education, self-care education about 10 years ago, really wanting to help other people learn what I learned. I felt almost selfish not sharing, because all of my symptoms went away. So that means other people must be out there feeling the way that I was feeling, right? So what I do is I really meet people where they are, and I educate them in the way that they learn best. So whether that's my online programs, I have a program called RX Inner Peace, a physician's guide for self-care, which is CME accredited, and that combines online self-paced learning in very short videos, because Physicians are really busy people, right? So 15 minutes or less, just like my podcast, very short in general, 15 minutes or less. And also the group and private coaching with me, right? So we get to learn how to work with the physiology, and you get to learn how to work with your mind, really combining that. And I don't know any other individual that's licensed and certified in the combination of things that I am that combine both of those disciplines in education. So that's one way. I also have a lot of shorter programs that are open to healthcare professionals and non-healthcare professionals that focus on a specific topic, right? So maybe you want to learn about meditation. Maybe you want to release chronic tension in your body. Maybe you want to work with your breath and so on. Maybe you want a combination of those. So there are lots of courses that are 4 hours each that you can learn that way. And I do private coaching one-on-one. Some people are just saying, I just want to work with you, just you. Let's do that. So that's available too. And everything, if you're a healthcare professional, is CME accredited that I offer. You mentioned retreats. Yeah. You want a retreat. I create retreats. I also go to retreats and present. I present at workshops and conferences. And you mentioned my podcast. So that's a real easy way to learn from me as well.
Yeah. That's so many available resources, and I encourage all the listeners to really check out Robyn's material. I know she has a lot of wealth of information. So what and what is the best way for people to get in contact with you?
Yeah, so through my website is stressfreemd.net. If you want to hop on a call, I'm happy to talk with you in a free call, see how I can get you started on living the stress-free life. I also have 3 free videos. So if you just want to check out a calming breathing tool, a way to release tension in your neck and shoulders, even a guided meditation, you can find those 3 free videos on my website. And I'm on social media. I'm all over. So what's your favorite social media platform? You'll find me. I am on LinkedIn at Robyn Tiger MD. I'm on Instagram at Stress Free MD. On Facebook at Robyn Tiger MD. And let's see, Twitter, Stress Free MD. Yeah, Robyn Tiger MD. So you can find me on your favorite social media platforms. And I'm happy to help you in any way I can.
Excellent. Yeah, for all the listeners, we'll include all of Robyn's resources, links in the show notes. And before we call it a day, any parting words of wisdom and advice?
Yeah, I would say that if you're listening to this and you're connecting with me and saying, wow, like I feel that way now, I really hope you understand now that you're not alone, right? That you're not alone in how you're feeling. And I want you to also know that you have the innate ability to make yourself feel better in any given moment. You have the innate ability to live life on your terms, as Christopher says, right? So you just need to learn how. So there's nothing wrong with you. You just weren't provided that education. So just reach out, know that you can do it. And I'm here to help you get started so you can feel calmer, more grounded, and live a more joyful life.
Wonderful words of advice. So thanks so much. And we look forward to having you as a guest on future podcast episodes.
Thank you, Christopher. Thank you so much for having me.
Well, I hope you really enjoyed that fantastic episode with our special guest this week. Just remember, as a shout out to this week's sponsor, Dr. Heather Fork, MD of the Doctor's Crossing, who has come out with her new online course devoted to teaching you how to leverage social media to network online effectively for your next job, your career, or as a side income. Again, social media is very valuable in today's society. It can be used for marketing, advertising, selling, communication with your followers, growing your brand, influence, followers, as well as networking. So don't miss out. It's really important in today's age to really leverage technology, especially in the COVID age. So go to the link in the show notes below, and we'll see you back next week. I'm excited that you made it for another episode. You are truly the best. If you've been following the show for a while, you know that my passion is to bring you the education you need to find your path to financial freedom. Please come back week after week for new content, new resources, and great guests. Until then, if you haven't already, please be sure to check out the website, www.drchrislewmdphd.com for more support. I'll see you next week. I'm excited that you made it for another episode. You are truly the best. If you've been following the show for a while, you know that my passion is to bring you the education you need to find your path to financial freedom. Please come back week after week for new content, new resources, and great guests. Until then, if you haven't already, please be sure to check out the website, www.drchrislewmdphd.com for more support. I'll see you next week.